Now, the difference in news and information in Arkansas. This is THV 11 this morning.
And coming up, common vision trouble often leads people to consider LASIK, which can free them from having to wear glasses or contacts. We're going to talk to a doctor right after this.
Common vision trouble often leads people to consider LASIK, which can free them up from having to wear glasses or contacts. Now, while LASIK is the most popular eye procedure, there are other refractive surgeries that can be appropriate as well. Dr. Hester with the Little Rock Eye Clinic joins us this morning with more information on helping you see more clearly with refractive surgery. Glad to have you here today.
Great to be here.
Thanks for coming in. Very true when we say that, you know, everybody kind of knows what LASIK is, but others are people aren't as familiar with. But I understand that during your fellowship you made some interesting discoveries related to refractive surgery. I would love it if you could share some of that with us.
Sure. I was very fortunate after my general ophthalmic training to do an additional year of fellowship at the Baylor College of Medicine in Houston, Texas, with literally some of the world's experts in refractive surgery. And I just appreciate you guys having me on today to talk about LASIK, who it might be good for, and what to expect from the surgery.
Definitely. Now, what conditions can make people a good candidate for LASIK? I'm guessing one is you wear glasses or contacts.
That's it, yes. You know, we're looking for people that may be nearsighted, farsighted, or have astigmatism. But what I cannot overemphasize is the importance of a thorough and comprehensive vision screening test to see if you're a good candidate. So people can go to our website, littlerockeye.com, to take a self-evaluation test, but you really need an in-office evaluation, which we offer for free at the Little Rock Eye Clinic, for people to see if they would be a good candidate.
What are things that you specifically are looking for when deciding?
So if people would come into the office, one of the things I want to be checking is make sure they have normal thickness corneas. I want to make sure they don't have too much an extreme nearsightedness, farsightedness, or astigmatism. And I want to make sure there's certain eye diseases that's not going to cause them to not receive the optimum results, such as glaucoma, cataracts, retinal diseases. And we also check the rest of their body to make sure there's not autoimmune conditions, or they're not taking medicines that could affect how they heal that would affect the results as well. Okay,
now alternatives to LASIK, what can we look for?
So there's a number of other laser procedures that can be done. One of them's PRK, photorefractive keratectomy. There's incisional surgeries through relaxing incisions, and sometimes it's best not to touch the cornea of the eye, but actually to do an intraocular surgery to where we'd place a lens in the eye.
Okay, and how does that differ from what you would be doing with LASIK? What's the big difference there?
Well, can I walk you through kind of how the LASIK procedure works?
Please do, yeah.
So someone comes to the office, we'll do a wave scan of their eye. This basically takes a thumbprint of their refractive error. Is what we usually correct with glasses. And then on the day of surgery, what we do is we create a flap here in the cornea with the laser. It used to be done with the metal blade, but now we can do it with the laser. We lift the flap, and then we'll do the LASIK treatment inside the cornea, correcting the refractive error, put the flap back down, and then usually about a day afterwards, people can see good. Now, there's other surgeries that you're asking me how that might work. Some of them we do not create a flap if the cornea is too thin, and then sometimes we do not want to touch the cornea because they might not be a good candidate for doing surgery on their cornea. In that case, we'll actually go inside the eye. We can place lenses inside the eye back here behind the cornea.
Okay, so something that it looks like it's pretty complicated, but I'm guessing wonderful results from those surgeries.
Make sure you have the right person. That's why it's so important to have a thorough, customized vision screen to determine what procedure is best for the patient. Okay,
and this is pretty neat. You can actually take a quiz online at littlerockeye.com to determine if you should come in and get a free refractive surgery screening. Dr. Hester, thank you so much for coming in today.
Thanks so much for having me.
Appreciate it.